Chiropractic and osteopathic manipulation are used as a complementary alternative medicine treatment. So what is chiropractic manipulation? So the manipulation of the bones is performed usually by hand, which is the traditional method, or a tool called an activator. And chiropractic care is used to improve functional use and help with pain relief, correcting alignment, and supporting of healing. Chiropractic care can be performed for lower back pain, and lower back pain is commonly treated with chiropractic as part of the care guidelines. Chronic lower back pain is associated with altered pain processing. Central sensitization is considered a factor in the progressing of acute pain to chronic pain, and research of 110 participants with lower back pain show that the attenuation of pain sensitivity is greater in response to spinal manipulation therapy. These findings suggest a potential mechanism of spinal manipulation therapy related to the lessening of central sensitization. Because chronic lower back pain is associated with altered pain process, this research supports that. The history of chiropractic therapy goes back for centuries. In the Greek culture, it was used and it was considered to specialize in the treatment of uncomplicated fractures. It's used in African nations. South Americans also performed under the name of bone setters. This is a traditional, like I said before, for centuries, and it's continued throughout the present day. Sobadores in the Hispanic culture are performed traditionally for centuries and also continue through the present day, and actually you're seeing an uptick of it in the southern states and the eastern seaboard, where the population of immigrants is heavier. Chiropractic in the United States was established in 1895 and continues throughout our days. So the founding of chiropractic as we know it today was established by D.D. Palmer, or Daniel David Palmer, in Davenport, Iowa in 1895. The janitor in his building developed hearing loss after feeling a pop in his neck, and D.D. Palmer was familiar with the term bone setters, and so he decided to try manipulating the janitor's spine, and the janitor allegedly had improved hearing after this. Palmer, being a scientist, being knowledgeable about the bone setters, he had practiced another alternative form called magnetism, and he went on, along with his son, to establish what we now know as chiropractic. And they went through the trials and tribulations of trying to get chiropractic established as an actual medical treatment. So chiropractic or osteopathic manipulation is used by 8.5% of U.S. adults and actually 3% of children in the U.S. as well. Chiropractic, as I said before, is the most commonly used treatment for back pain in the U.S., from which 66% of patients report a perceived great benefit from their treatment. Chiropractic is used for many musculoskeletal ailments such as pain, strains, headaches, subluxation, and misalignment. Chiropractic care is the second most commonly used alternative medicine, with a provider delivering the care, as seen in this graph below. So the safety and adverse effects of spinal manipulation, the research is ongoing. There hasn't been a lot of research performed as to what the serious effects are Most people who use chiropractic report minor side effects, which can be temporary headache, tiredness, or discomfort, and this is reported by 30 to 60% of patients. There are rare reports of stroke after manipulation therapy. Disc herniation has been shown to have a low risk of worsening with treatment. Cervical manipulation risks are unknown. The most severe risk is thought to be VBA, which is vertebral-basilar artery stroke, and VBA dissection, which more research is needed to strengthen the correlation of that. Another serious implication or side effect that is not well documented are reports of cauda equina syndrome, which is a significant narrowing of the lower part of the spinal canal in which the nerves become pinched and may cause pain, weakness, loss of feeling in one or both legs, and bowel and bladder problems following spinal manipulation. The limitations of treatment are that there are contraindications such as acute myelopathy, fracture, dislocations, rheumatoid arthritis, and osteoporosis. Chiropractors do not prescribe pharmaceuticals or provide surgical interventions. And the bone setters and sobadors are limited because they often practice in rural or poor areas and have limited resources when needing to refer patients on for a higher level of care. And of course, they have limited training. It is all informal. Chiropractors do, since they cannot prescribe pharmaceuticals, they do, though, want their patients to use more homeopathic methods and will present the options for the use of supplements. Thank you for your time.